Hello, Dr. Jason here with Elevate Chiropractic and Rehab, here to go over you with the exercise, the bridge exercise, and some of the progressions for the bridge. Excellent exercise for low back pain. We give it to a lot of our patients. This is Michelle, and she's going to help us out. So let's start by bringing, with the glute bridge, we want to have our tibia, which is the lower leg, close to perpendicular with the ground. One cue that I give to set this up is to have your hands on your side and try and touch your heels with your fingertips. All right, now from here, Michelle is going to start with her hands just lying straight out like this on the ground. And this would be the first arm position when you first start doing this exercise. You're going to bring your knees close together. And first I want you to activate the low back into the mat. So you feel the anterior core musculature here. And you're going to stay conscious of that musculature throughout the whole exercise, because one of the biggest problems with the glute bridge is that people will have a tendency to overextend their back, which is very compressive to the low back, especially the lumbar spine, and it can irritate your back pain. And we want to do the opposite, which is help your back pain. So, Michelle, go ahead and activate your core as you squeeze your back into the ground, and then be conscious of those muscles as you now drive your hips towards the ceiling. And we're going to try and achieve a straight line from the knee to the hip to the shoulder, and this is the quintessential bridge position. Now, Michelle's been practicing these a lot, so she's ready to progress already. And we're going to start with the first progression, which is keeping the knee bent and raising the foot off the ground, so you're balancing on one leg and slowly lower. Good. Now when you're doing this at home, I want you to, let's switch sides, and I want you in this position and to hold for 3 seconds as you go through your normal breath cycle, making sure to breathe with the breathing pattern that we taught you in our breathing video, which you should watch if you haven't. Michelle, go ahead and lower down, and we'll give her a little rest so that she can maintain an excellent form for you. Let's go back up into the bridge position. This time we're going to have her bring her arms to her hips. There we go. Good. And we're making sure to maintain this plank position, but also staying in contact with these muscles here, making sure not to create hyperextension in the low back. Now, keep your knees close together. Keep your femurs parallel as you raise this leg. And keep that there. Perfect. And you're holding for 3 seconds, making sure not to drop the hip over here, making sure not to hike the hip over here. Lower down, reconnect with the glutes as we come to the plank position, because we'll always have a tendency to lose a little height when we raise one leg. And raise your other side for me, keeping the femur nice and parallel, and making sure to really keep that height. Slowly lower the leg for me. Good. And relax to the ground. And it's important that you give yourself rest in between sets, not to overdo it, because we want to make sure that we're keeping the proper form. That's when we get the most benefit from the exercise.